Polycystic ovary syndrome, or PCOS, is a common hormone condition. It affects many women during their reproductive years. The name can be a little misleading. It makes you think it's all about having cysts on your ovaries. However, that's only one part of the story, and not every woman with PCOS has them. Think of it more as a communication breakdown within your body's hormonal system. Your brain, your ovaries, and your adrenal glands are not quite in sync. This hormonal imbalance is what leads to the wide range of symptoms that women experience. It's a whole-body metabolic condition, not just an ovarian problem. The core issue in most cases of PCOS is something called insulin resistance. Insulin is a powerful hormone that helps your body use sugar for energy. When your cells become resistant to insulin, your pancreas has to work overtime, pumping out more and more of it. This high level of insulin is what causes a lot of trouble. It can signal your ovaries to produce too much testosterone, which is typically a male hormone. This excess testosterone is a key driver behind many PCOS symptoms, from acne to irregular periods. It also makes it harder for your body to ovulate regularly, which is the central feature of the condition. It's important to understand that PCOS is not a single disease. It's a syndrome, which means it is a collection of signs and symptoms. There are actually different types of PCOS. The most common is insulin-resistant PCOS, which we just discussed. But there's also post-pill PCOS, which can happen temporarily after stopping hormonal birth control. Some women have inflammatory PCOS, where chronic inflammation is the main driver of their symptoms. Then there is adrenal PCOS, which is related to an abnormal stress response. Identifying the type you have is the first step toward finding the right treatment path for your unique body. So, what does this all mean for your health? PCOS is more than just a reproductive issue that affects your periods. Because it involves insulin and inflammation, it can have long-term effects on your overall health. It increases the risk of developing type 2 diabetes, high cholesterol, and heart disease later in life. This might sound scary, but there is good news. By understanding what is happening inside your body, you can take powerful steps to manage your symptoms. You can also significantly reduce these long-term risks. It's all about restoring hormonal balance and improving your body's sensitivity to insulin. One of the most common and frustrating symptoms of PCOS is irregular periods. This doesn't just mean your cycle is a few days off. It often means having very long cycles, sometimes 35 days or longer, or skipping periods for several months at a time. Some women might have only a few periods a year. This happens because the hormonal imbalance of PCOS interferes with ovulation. Without the regular release of an egg, your body doesn't get the hormonal signal to shed the uterine lining. This irregularity is a key sign that something is not right with your monthly cycle and deserves attention. Another group of symptoms is caused by high levels of androgens, like testosterone. This is often referred to as hyperandrogenism. You might see this show up on your skin as persistent acne, especially along the jawline, chin, and upper neck. This type of acne is often deep, cystic, and painful. You might also notice oily skin and hair. Another sign is hirsutism, which is the growth of coarse, dark hair in places where men typically have hair. This can include the face, chest, back, and abdomen. While these symptoms can be distressing, they are direct clues from your body about the underlying hormonal imbalance. Weight gain, or difficulty losing weight, is another major challenge for many women with PCOS. This is directly linked to insulin resistance. When your body can't use insulin effectively, it's more likely to store glucose as fat, particularly around the abdomen. This can create a frustrating cycle. The excess weight can worsen insulin resistance, which in turn makes it even harder to lose weight. It's not about a lack of willpower, it's a real metabolic hurdle. Understanding this can help you approach weight management with more compassion and with strategies that actually address the root cause, which is the insulin problem. Beyond these main symptoms, PCOS can affect you in other ways. Many women experience hair loss or thinning on the scalp, similar to male pattern baldness. Fatigue is also incredibly common, as your body struggles with energy regulation due to the insulin issues. Mood swings, anxiety, and depression are also frequently reported, linked to the hormonal fluctuations and the stress of managing a chronic condition. It is important to remember that all these signs are connected. They are your body's way of communicating that its internal environment is out of balance and needs support to get back on track. Diagnosing PCOS involves a bit of detective work. There isn't one single test that can give a definite yes or no. Instead, doctors use a set of criteria called the Rotterdam criteria. To be diagnosed, you generally need to have at least 2 out of these 3 things. The first is irregular periods, or a complete lack of periods, which points to ovulation issues. The second is clinical or biochemical signs of high androgens. This could be physical symptoms like acne or hirsutism, or it could be confirmed through blood tests. The third is the presence of polycystic ovaries, seen on an ultrasound scan. Let's talk more about the tests. An ultrasound is often used to look at the ovaries. The term polycystic means many cysts. In PCOS, these aren't true cysts, but rather small, undeveloped follicles. Think of them as eggs that started to mature but then stalled in the process. An ovary with 12 or more of these small follicles might be classified as polycystic. However, it's crucial to know that you can have polycystic-looking ovaries without having the syndrome. Conversely, you can have PCOS without having this classic appearance on an ultrasound. It is just one piece of the puzzle. Blood tests are essential for a proper diagnosis and for identifying your type of PCOS. Your doctor will want to check your hormone levels. This includes androgens like total and free testosterone. They will also look at other hormones like LH, which is luteinizing hormone, and FSH, which is follicle-stimulating hormone. In classic PCOS, the ratio of LH to FSH is often elevated. To rule out other conditions that can mimic PCOS, your doctor will also test your thyroid hormones and prolactin levels. These tests provide a clear picture of what is happening with your body's hormonal signaling and help confirm the diagnosis. For a truly accurate picture, the timing of these blood tests matters. The best time to test most reproductive hormones is in the luteal phase of your cycle. This is the 2-week window after ovulation and before your period starts, typically around day 21 of a 28-day cycle. Testing during this phase allows your doctor to confirm whether you have actually ovulated by measuring your progesterone level. A low progesterone level during this time confirms anovulation, which is a cycle without ovulation, and that's a key part of PCOS. Your doctor can also assess your insulin and glucose levels to check for insulin resistance, which is best done in a fasting state. Lifestyle changes are the most powerful medicine for managing PCOS, especially insulin-resistant PCOS. The goal is to improve your body's sensitivity to insulin and reduce inflammation. Nutrition plays a starring role here. This doesn't mean you have to go on a restrictive diet. Instead, focus on eating whole, unprocessed foods. Cut back on sugar and refined carbohydrates like white bread, pasta, and pastries. These foods cause a rapid spike in blood sugar and insulin. Instead, build your meals around protein, healthy fats, and lots of fibrous vegetables. Think chicken or fish with a large salad, or eggs with avocado and sautéed greens. Regular movement is another cornerstone of PCOS management. You don't need to spend hours at the gym doing intense workouts. In fact, overly strenuous exercise can sometimes increase stress hormones and inflammation. Gentle, consistent movement is key. Activities like walking, swimming, yoga, and light strength training are excellent choices. Strength training is particularly beneficial because building muscle helps your body use glucose more effectively, which directly improves insulin sensitivity. Aim for about 30 minutes of moderate activity most days of the week. The key is to find something you enjoy so you can stick with it long term. Several natural herbs and supplements can provide wonderful support for PCOS symptoms. For example, inositol is a B vitamin-like compound that has been shown to improve insulin sensitivity and promote ovulation. It can be very effective for restoring regular cycles. Another helpful herb is licorice root, which can help lower testosterone levels, especially when combined with white peony. For managing blood sugar, cinnamon is a great addition to your diet. It can help improve your cell's response to insulin. Always talk to a knowledgeable practitioner before starting new supplements to ensure they are right for you and won't interact with any medications. Finally, managing stress is non-negotiable for anyone with PCOS. Chronic stress raises cortisol, which can disrupt ovulation and worsen insulin resistance. Finding healthy ways to cope with stress is vital for your hormonal health. This could be a daily mindfulness or meditation practice, spending time in nature, or ensuring you get enough quality sleep. Getting at least 8 hours of sleep per night is crucial for hormone regulation. Taking these simple, consistent steps to nourish your body, move gently, and calm your nervous system can lead to significant improvements. You can live a healthy, vibrant life with PCOS.